All right, guys. So today I want to talk to you about something that we see quite commonly, especially in runners. Okay, and it's something we call an Achilles tendinopathy. So a tendinopathy is kind of an umbrella term for anything that happens to the Achilles tendon. So let's talk about what that is. So this is a foot, this is a right foot, and as many of you know, there's a really big, thick, strong tendon that runs right along the back of the calf here, and that's called the Achilles tendon. And it's actually the tendon of the soleus and the gastroc. Those two muscles come together on this same tendon, and they attach right here at the heel, which is called the calcaneus. Okay, so a tendinopathy is kind of an umbrella term for anything that happens to that tendon. And this can range from anything from a tendinitis, which is just a slight irritation or aggravation that happens often with overuse. And it can go all the way up to something, as serious as a complete rupture, but more often you get things like a tendinosis, which is kind of a breakdown of that tendon because of chronic inflammation over time. Okay, so let's talk about signs and symptoms. Basically, how are you going to know if you have this? So often you'll start to get some pain right along this heel, right along the heel here, kind of right at the base of that tendon, and then maybe up into that kind of tendony part right through here. You may as well get some pain up into the calf a little bit, but most of the time you find it right along the edge of the heel. Okay, and that pain is often going to be associated with running or with going up onto your toes. Sometimes it'll happen as you're going up the stairs and you push up onto your toes. As you engage that muscle and it tugs and pulls on the tendon, that's when you get a lot of those painful symptoms. Okay, you may also notice that you get weaker. You're not able to do that as much, or you have a hard time doing that, and you find that it just gets really stiff and achy with rest. Okay, so let's talk about how this happens. Most of the time, this is an overuse injury. Okay, this happens when you end up increasing your running load, right? Maybe you were running a mile a week and now all of a sudden you jump up, you're training for a marathon and you jump into 5 miles a week. Okay, something that's that big of an increase can cause an irritation at the tendon and then start to cause it to break down. If you ignore it and don't do anything about it, and then it turns into a tendinosis, okay, basically that inflammation just sits right along the tendon and it actually causes it to break down and to actually change what it looks like under a microscope. Okay, so that's kind of how it can happen, and my recommendation for preventing this is to actually not increase your load too hard, too fast. Okay, so now let's talk about treatment. The treatment for an Achilles tendinopathy depends on what it is. A tendinitis is going to be more something where we kind of back you off a little bit. We do a lot more gentle range of motion type things, just kind of anti-inflammatory things to calm it down while that tendon heals. And that's usually a pretty quick thing. If you have more of a tendinosis where you've actually had a breakdown or a change in what the structure of that tendon looks like, that is going to be more of a progressive loading regimen. And we personalize that depending on what you're dealing with. We personalize that to each and every patient. But with a tendinopathy, the goal really is to find the optimal load for you. How much can we push and challenge that without pushing you so hard that you end up increasing your pain? And this is something that we love to do, we love to see, and we love to help getting people back to where they like to be and doing the things that they love to do.